These things are wrong, and you practice all these things in 9 months' time. We'll come and celebrate with you and eat chicken. And someone using the contraceptive, that does not mean that the contraceptive is the best one for you. Condom, you're using a condom and it tears. You can use an emergency contraceptive. Hi guys, welcome back to my YouTube channel. I'm Dr. Hilda and my YouTube channel is about health and lifestyle where I give you all tips on common health conditions and I show you how I live my life. So I'll be posting videos once every week on Sundays. So if this is your first time here, please subscribe, and if you're a returning subscriber, welcome back. So in today's video, I'm talking about contraceptive methods, also known as family planning, also known as birth control methods. So what are contraceptives? Contraceptives are any device, any drug, any procedure, or any practice that is used to prevent pregnancy. That's just what it is. That's as simple as that. Anything that prevents pregnancy. That's what it is. So before I get into the video, I'll quickly address things that people do, practice to prevent pregnancy that are wrong. First off, some people believe that you should do an exercise, a vigorous exercise, mainly after sexual intercourse to prevent pregnancy from occurring. Some people believe that you should even drink bitter substances like stout or even take salt solution to prevent pregnancy from occurring. That's very wrong. And some people even believe that if you wash up immediately, the sperm you're going to wash out the sperm cells and you will get pregnant. These things are wrong, and you practice all these things in 9 months' time. We'll come and celebrate with you and eat chicken and just be happy with you. So if you want to know reliable ways of preventing pregnancy, just sit back and come on this journey with me. So there are so many ways, so many means of preventing pregnancy. I can't even exhaust them in this video. However, I would be listing the common ones that are available in our environment. So there are different groups, and the first group I'm talking about are the natural ways of preventing pregnancy. In this group, the first example I'm talking about is abstinence. Yeah, abstinence. If you don't want to get pregnant, do not have sexual intercourse and you won't get pregnant. It's as simple as that. That's just what it is. Yeah. So the next example in this group is the calendar method. So the calendar method entails that the woman studies her cycle for at least 6 months. She knows her cycle length and she has an idea of her ovulation day. So around ovulation day, 3 to 5 days before and about 2 days after, that's her fertile period, and she's to stay and she's to prevent sexual intercourse during that period. However, if she wants to have sexual intercourse, you can go ahead and do, but you should use another method of contraceptive like a condom to prevent you from getting pregnant. So the next example I'm talking about under this natural method of preventing pregnancy is coitus interruptus, also known as the withdrawal method. So this method entails that the penis is pulled out just before ejaculation occurs. But the good thing about this method is that it's actually cheap and you don't need to buy anything. But the downside to it is that some semen can be produced just before ejaculation occurs, and this semen can contain sperm cells that can also fertilize the egg and lead to pregnancy. And some people may even get carried away and not pull out early, and ejaculation will even begin to occur before they remember to pull out. And we all can say that these are not effective means of preventing pregnancy. So the next group I'm talking about are the barrier contraceptives. So a lot of examples, but the commonest one everybody's familiar with are the condoms. So people are more familiar with the male condoms. You can get them in pharmacies around you or stores around you. So the good thing about male condoms is that it prevents sexually transmitted infections like HIV, hepatitis, and but the downside to it is that it reduces spontaneity, and some people may just get carried away and not wear a condom, and it's going to lead to pregnancy. So the female condoms are similar to the male condoms, just that they are worn by females. The thing about the female condoms is that they are not really available and they are pricier than the male condoms, but they work in the same way. And you shouldn't, if you're using a male condom, there's no need using a female condom at the same time. So other barrier contraceptives include cervical caps, diaphragm that can be inserted into the vagina, They're not really common like that, but they are barrier contraceptive. Under barrier contraceptives are the spermicides. So spermicides can come as a gel, a cream, or a sponge that can be applied into the vagina prior to sexual intercourse. These spermicides work by destroying the sperm cells, so preventing fertilization from occurring. So these are the barrier contraceptives. So we'll be moving on to a very large group of contraceptives known as the hormonal contraceptives. So there are a lot of examples under this group, under this family. So the first I'll be talking about are the pills. So there are different types of pills. There's the combined pills, that's combination of estrogen and progestin, and then there's the progestin only pill. Regardless of the type of pill you're taking, you have to take this every day, every day. You shouldn't miss it. And they are very effective in preventing pregnancy. However, if you're on the pill, it's very important that you do not miss a pill. And if you miss a pill, when you remember that you missed the pill, you should take the pill that you've missed and you should take the next scheduled dose. But the thing is that within the next 48 hours, you have to use another method of contraceptive like a condom to prevent you from getting pregnant. So this downside to pills that it has hormones and like estrogen, so you may have the side effects of the hormones in your body like breast tenderness, acne, and the rest of that. So under hormonal contraceptive, I'm talking about are the implants. So the implants are very tiny devices, very, very tiny, just like the size of a matchstick. So they're usually placed in the inner and upper part of the non-dominant arm. That is, if you're right-handed, it will place in your left arm and vice versa. So these implants are long-acting contraceptives and they can stay for a very long time, about 5 years, and prevent you from getting pregnant. So these implants contain hormones and these devices release the hormones in tiny quantity into your blood, thereby preventing pregnancy from occurring. So the good thing about implants is that they are very effective in preventing you from getting pregnant and they don't have a washout period. That is, when you do not want to get pregnant again, they, as I mentioned, that they can stay for 5 years. But if it's not up to 5 years and you want to get pregnant, you can take it out. Like you're free to take it out and you get pregnant. And once you take it out, the good thing is that it doesn't have a washout period. That's you can get pregnant immediately because you've taken out the hormone out of your body. Unlike another class I'll be listing later. So the downside to it, there's not really down a lot of disadvantages to this implant. It's just that you will need a minor surgical procedure to take it out. However, you'll be given a painkiller. That's you'll be given a local anesthetic around your skin to prevent you from feeling pain. That's just it. So the next hormonal contraceptive I'm talking about are the injectables. So the injectables are hormones that are injected into the blood, into our body to prevent pregnancy from occurring. So they're usually taken every 2 to 3 months to prevent pregnancy from occurring. They're effective in preventing pregnancy. But the downside, okay, let me talk about the good part first. The good thing about the injectables is that it doesn't affect breastfeeding. So if you're a breastfeeding mom, you can use the injectables. It doesn't affect lactation, that's breastfeeding. You can still breastfeed your child without any problems. Then the downside to it is that there's a washout period. That's if when you want to get pregnant, you might have to wait for a while because the hormone has been injected into your blood. So you have to wait for a while for it to be completely washed out before you'll be able to conceive. But eventually you would conceive. So another example I'm talking about are the IUCDs, which stands for intrauterine contraceptive devices. So there are two types: that the hormone containing ones, and there's the copper containing the copper IUCD. So the hormone ones, depending on the type, it can stay for 3 years, can stay for 5 years, and the copper one can stay up to 10 years. So usually inserted into the uterus, that's the womb, and prevents pregnancy from occurring. So it's a very flexible device that is inserted through the vagina into the uterus. Don't worry, don't be scared. You barely even notice that it's there and it stays for a very long time. That's the advantage of it. And usually more suitable for women that have given birth already. But the downside to it is that it may cause menorrhagia, it may lead to increased bleeding. I'm moving on to the emergency contraceptives. So emergency contraceptives are means of contraceptives that are used when, like just the word emergency, when there's an emergency. let's say you have an unprotected sexual intercourse, or you already have a contraceptive but your contraceptive fails. Example, a condom, you're using a condom and it tears, you can use an emergency contraceptive. So we have the pills, that's the morning, commonly known as the morning after. A very popular brand is the Posino 2, which is usually taken which should be taken within 72 hours after unprotected sexual intercourse. And it's important to note that the earlier you take this pill, the more effective it is. And the thing is that it's not going to prevent all pregnancy from occurring, but it prevents most pregnancy from occurring, especially if it's taken very early after an unprotected sexual intercourse. The thing about emergency contraceptives is that it shouldn't be your go-to every time. Like, it should just be for emergency, like when the need arises. So if you want if you want a contraceptive that you're going to be using long term, you should opt for other ways like the pills, the implants, the injectables, and other ones I've talked about. So there are other means of contraception, that's the surgical methods, which are permanent. They are good for people who have completed a family cycle and are not looking to have more children. So we have the one for females and one for males. The one for females is called bilateral tubal ligation, where the fallopian tubes are cut or blocked or tied to prevent the movement of the ovum, that's the egg, from the ovary to the uterus. And we have vasectomy for males, where the tube that transfers sperm cells from the testicles to where they'll be ejaculated are cut or blocked. And so this is a surgical procedure that is done in males. There are many more contraceptives that I haven't discussed, or I've not even talked about most of the advantages or disadvantages. I just listed the common advantage or disadvantage. There's still more to know. For a way of preventing pregnancy from occurring, you should go to a healthcare facility. Don't be scared. Don't be scared they're going to judge you, they're going to shout at you. No, nobody's going to judge you. There are staff that are trained to give those services, and that's why they are there. So just go there. They will want to find out your medical history, and you and your doctor or healthcare provider will come up with the relatively ideal contraceptive for you. I use relatively ideal because there is no best or ideal contraceptive. And let's just bear in mind that every contraceptive can fail, but there are some contraceptives that are more reliable than others. So it will depend on your age. It will depend on if you want to get pregnant in future. It will depend on the money you have, that's the cost. And there are other, your medical condition, your background medical condition. Those are the factors that are going to come into play while when you're trying to choose a contraceptive. So if you see someone using a contraceptive, that does not mean that the contraceptive is the best one for you. So don't just copy somebody. Okay, you saw a friend using this type of contraceptive and you want to get a contraceptive. You should go to a healthcare provider where they can examine you, know your blood pressure, know if there's any underlying medical condition that will contraindicate a particular contraceptive from being used. So we've come to the end of this video. Thank you for watching. If there's anything I've said that you do not understand, or if you have any question concerning contraceptive or any health condition at all, please feel free to drop in the comment section. Don't forget to like this video and please turn on the bell notification so you get notified anytime I post a video. Thank you so much for watching and see you in my next video. Bye.